I'm the mother of a boy. He's 11. His name is Ethan. He first showed symptoms of asthma when he was 2 years old, so just before he turned 3. He had a virus and it sort of led to breathing problems. And we took him to the GP and were prescribed an inhaler, a reliever inhaler. But for me, it was a brand new thing. I didn't know anything about it. I didn't even know how to use an inhaler. And when I filled the prescription, it was actually the pharmacist that showed me how to use the inhaler. But didn't realise at that point just how seriously ill he was. So he was very young, and I know at the time they were very reluctant to make a diagnosis because of his age. And they diagnosed him with asthma based on the family history rather than performing any other kind of tests. The only sort of testing we ever had was if he was in hospital, having an asthma attack. I mean, it's really difficult as a parent. You really want that diagnosis. So the testing process is something that I would feel is necessary. But obviously, from my child's point of view, and especially very young children, it's not something that they can always understand, especially if you're sort of looking at children at sort of 5 years old. It's going to hospital, to a doctor's surgery and having these tests performed. It must be quite a scary experience for them. But I mean, what do? You want diagnosis, you want that child to be treated. So sometimes I think you have to put them through these things sort of, quickly, and then come away with a diagnosis so you can treat them, because in the long term, they're going to be much better off. And then the treatment, I think it's not just having those tests, but understanding why you're having them. And I think as a parent, you would probably feel like you were getting, a better sort of rounded experience of being able to get diagnosis. So it's fine if you have a family history and people, doctor says to you, we think it's asthma, we're going to treat it as asthma because you have that in your family. If you've got the tests as well, it's a better way of sort of backing up what they're telling you, to try and get a proper diagnosis. I don't know other people's experience of it, but for me, I think I would have felt more confident having had those tests as well, and the doctor being able to say to us, yes, it is asthma because we've looked at your family history, we've run these tests, and everything points towards asthma, and that's what we're going to treat. I think the main thing is really communication is key, that medical professionals explain to the parents and to the children exactly what these tests are, how they're going to be performed, and what they can actually tell you. So how these tests combined can lead to a diagnosis. And then also explaining how treatment should work. So really simple things like, how do you use an inhaler properly? What's the correct inhaler technique? Because these are things parents don't necessarily know. And I think sometimes it's just those simple things that get overlooked by medical professionals, because they're so sort of tuned into, this is the test, this is what it's going to tell me. But we're not all medical professionals, we're just concerned parents. So it's just keeping that communication going and making sure parents understand what's happening all the way through the diagnosis process.